Assalamu alaikum. This is Dr. Tazeen, your mentor and course director for Study MRCPI, and we are here with another YouTube series for all of you, which is about human papilloma virus vaccination. And I will be candidate, and with me, examiner would be Dr. Soumya. If you have not subscribed the YouTube channel of StudyMEDIC, subscribe now and just click on the bell icon so that you can stay updated with the YouTube series, and you should go all the sessions which have been uploaded on the channel, so that these are very, very important topics which you should go through, and they can help you a lot in your exam. So we shall start the session, and before starting the session, just remember that your passion and dedication can lead you to success. So this might be difficult, but you are capable and you can do that. Hello, Dr. Soumya.
Hello, hi Tazeen. Yes.
Thank you so much for joining, and thank you so much for your time. So we can start. As all of you know that there is no reading time in in MRCPI exams. So you should be very careful that you just have 30-40 seconds to go through the candidate instructions, and then you can start your discussion. Meanwhile, if you want to have a look, you will have task in front of you on the table, and you can go through the task again during the discussion if you need to know anything from the task. Hello, this is Tazeen. I have read the instructions and I am ready for structured discussion.
Okay, as you're aware, this is purely the discussion would be on the HPV. So, can you tell me a bit about HPV and why do you think it is important?
All right, thank you so much for the question. Human papilloma virus is a commonly sexually transmitted infection with which the most of the individual during their lifetime while they are sexually active, they can have this infection. This is high risk and it is associated with a few of the cancers, like 16 and 18 are the strains which are very high risk, and they are associated with 70% of the cervical cancers. However, there are other types as well, like 6 and 11, they are associated with genital warts, and also the other strains, they are linked to vulval, vaginal, anal, penile, and oropharyngeal cancers.
Okay, so what about the HPV vaccine? Which type of vaccine it is and whom does it protect against and which cancers it protects against?
Human papilloma virus vaccine is a prophylactic vaccine that protects against infection with high-risk human papilloma virus types. It is commonly the vaccine which is used. It is a non-valent, 9-valent vaccine which protect against 16 and 18, which are high-risk cancer-causing strains. Then other high-risk are 31, 33, 45, 52, and 58 types, and low risk types are 6 and 11, which are associated with genital warts.
Okay, so who should be offered? Who should be the beneficiaries of these HPV vaccines?
This vaccination is recommended for boys and girls aged 12 to 13 years as part of their national programs, and ideally it should be given before they start sexual activity. And the catch-up vaccination can also be given up to age 25 or according to the national policies, even if they are sexually active, who are unvaccinated. Vaccination is actually beneficial even if someone has started their sexual activity, as they are unlikely to be exposed to all the types of HPV. So this can benefit them even if they have started sexual activity, and up to 25 years it can be given.
Okay, what does this HPV vaccination schedule looks like?
This vaccination is given if the age of the individual is less than 15 years, then 2 doses are given. The first dose and the second dose should be given 6 to 12 months apart. And if the age of the individual is 15 or more than 15 years, or they are immunocompromised, then 3 doses are given, which is given at 0, 2, and 6 months.
Okay, so how safe is this and can you take me through the side effects of this vaccine?
Yes, this vaccination has been extensively studied, and it is recommended that it is a safe vaccination, as so far no adverse lethal side effects have been reported through the studies. Common side effects are, as this is given as injectable, so pain or redness at the injection site, or slight swelling or edema can be there. Mild fever and headache can also be associated with this vaccination. Serious adverse effects are extremely rare, and there is no evidence which can link that this vaccination can lead to subfertility or autoimmune diseases or any chronic illness.
Okay, in special conditions like pregnancy, is the HPV vaccine recommended?
Human papilloma virus vaccination, it is not routinely recommended during pregnancy, and there is very limited data that this pregnancy should be recommended during pregnancy. However, if a woman is inadvertently given vaccination during pregnancy, then there is no evidence that it will cause any feto-maternal harm, and there is no intervention needed. Remaining doses, they should be deferred until post-delivery.
Okay. Since you said it's prophylactic, does vaccination replace the screening, cervical screening?
No, human papilloma virus vaccination does not replace cervical screening. Vaccinated women must still, they should follow their regular cervical screening plan, as the vaccine does not protect against all the human papilloma virus types.
Okay. Now, let's go back to the patient turn view. So, Ms. Aisha Khan has come to you for the HPV vaccine. Can you take me through how would you counsel her?
Yes. First of all, I will appreciate the patient that she has come for to know about this vaccination, and I will reassure her that this vaccination is safe and effective way to significantly reduce the risk of human papilloma virus associated cervical cancer in the future. Even though she is sexually active, she can take vaccine, and I will recommend that she should immediately start vaccination. And also, I would encourage her to continue with the screening programs of the cervical screening as per the guidelines which are there. And I would encourage her to follow the screening program as well as to receive the vaccine.
Okay, fine. Those are the questions which I had. Well done. Thank you.
Thank you so much. Thank you so much.
Yes, I think that's because it's purely a knowledge-based one. So unless in all structure discussion MRCPI this happens, that they would be asked specific questions. Yeah, please go on. Yeah.
Thank you so much, Dr. Soumya. Thank you so much. So this was a task. What I feel that this task can be asked in two ways. This can also be a simulated patient task where the patient is there and you have to counsel them regarding human papilloma virus vaccination. And this can be a structured discussion as well, where the examiner has to ask them, ask you questions about human papilloma virus vaccine. So just have a look at the candidate instructions that Aisha Khan, 22-year-old woman, she wants to know about human papilloma virus vaccine, and the examiner is going to discuss with you that about human papilloma virus vaccine, and you have 10 minutes to answer all the questions. So what can be the potential examiner questions, that what is human papilloma virus and why it is important? What is the human papilloma virus vaccine and what does it protect against? Who should be offered the human papilloma virus vaccine? What is the vaccination schedule? Is the human papilloma virus vaccine safe? Can the human papilloma virus vaccine be given in pregnancy? Does human papilloma virus vaccination replace cervical screening? And how would you counsel this patient today, that if the patient is there, so how in a simple, understandable language you will counsel your patient? So human papilloma virus is an extremely common sexually transmitted virus. Most commonly, the sexually active individuals will be exposed at some point in their lives, making it one of the most prevalent sexually transmitted infection in the worldwide. High risk types, there are various types of human papilloma virus. 16 and 18 are high risk, which are responsible for approximately 70% of cervical cancers. These high risk strains are the primary target of vaccination programs. And human papilloma virus causes cervical, vulval, vaginal, anal, penile, and oropharyngeal cancers. And the persistent infection with high risk types leads to cellular changes that can progress to malignancy over time. Human papilloma virus vaccine protection and coverage. This is a non-valent vaccine, is the current standard offering prophylactic protection against HPV infection. It prevents infection but does not treat the existing human papilloma virus. It protects against human papilloma virus type 16, 18, 31, 33, 45, 52, 58, the oncogenic strains most strongly associated with cervical and other anogenital cancers. And it also covers human papilloma virus types 6 and 11, the low risk strains responsible for approximately 90% of genital warts, providing broader protection against human papilloma virus related diseases. So, who should receive human papilloma virus vaccine? Boys and girls, adolescents 12 to 13 years of age, young adults less than 25 years, even if they have started their sexual activity, and unvaccinated sexually active, they can also receive vaccine. There are national programs for both boys and girls 12 to 13 years. They receive routine human papilloma virus vaccine as part of national immunization schedule, providing early protection before the sexual debut. And catch-up vaccination, individuals up to age 25 and sometimes beyond, depending upon local policies, who missed routine vaccination remains eligible for catch-up doses. So sexual activity is not a contraindication to vaccination. Even sexually active individuals benefit from protection against human papilloma virus types to which they have not been exposed. Vaccination is beneficial even if someone is sexually active, as they are unlikely to have been exposed to all 9 human papilloma virus types covered by the vaccine. The vaccination schedule: under 15 years of age, 2 doses, initial dose followed by the second dose at 6 to 12 months. This accelerated schedule is sufficient for younger adolescents due to stronger immune response. 15 years and older, 3 doses, dose at 0, 2 and 6 months. Older adolescents and adults require 3 doses for optimal protection and antibody responses. And then those individuals who are immunocompromised, again 3 doses are given to them regardless of age at the start. Immunosuppressed individuals require the extended 3-dose regime for adequate immune protection. Safety and side effects is always a concern when the patient is coming, so it has excellent safety profile. The human papilloma virus vaccine has been extensively studied and across millions of doses worldwide, and it is proven to be very safe with robust post-marketing surveillance data. Common side effects are pain, redness or swelling at injection site, mild fever or headache, and transient fatigue can be there. These effects typically resolve within 1 to 2 days without any intervention. There is no evidence linking human papilloma virus vaccine to subfertility, autoimmune diseases, or chronic illness. Serious adverse effects are extremely rare. Special considerations about pregnancy and breastfeeding: human papilloma virus vaccination is not routinely recommended during pregnancy due to limited data. However, if inadvertently given, there is no evidence of harm to the mother or the fetus and no intervention is needed. If a woman discovers she is pregnant after starting the vaccination course, remaining doses, they should be deferred until after pregnancy and they can be completed in the postpartum period. And this vaccination is safe during breastfeeding. There is no restrictions on administering the vaccine to lactating women, as the vaccine does not affect milk production or quality. This allows mothers to catch up on missed vaccinations while nursing without any concerns. So the critical point: vaccination does not replace the screening. So vaccine coverage is not complete. The 9-valent vaccine protect against the most common oncogenic HPV types, but does not cover all strains that can cause cervical cancer. Screening remains essential. All women, including those vaccinated, they must attend the regular cervical screening when invited. And dual protection strategy, vaccination plus screening, provides the most comprehensive protection against cervical cancers. So candidates must clearly state that HPV vaccination does not eliminate the need of cervical screening. This is a frequent OSCE marking criteria. So if a patient is coming to you and this is a patient simulated task, how you have to counsel the patient regarding HPV vaccination. So remember that HPV vaccine is safe and effective way to significantly reduce your risk of cervical cancer in the future. when you are sexually active, the vaccine can still protect you against HPV types that may not have been exposed. As this patient has come to you, the scenario which is given, she is sexually active and she wants to know about human papilloma virus vaccination. So we have to counsel in such a way that this will protect you against the types which she is not exposed. Clear recommendation stating the benefits confidently and recommend starting the vaccine course immediately. Adverse individual circumstances, acknowledge her sexual activity status and explain continued benefit through this vaccination. Discuss the next steps, that 3 doses would be required as she is 22 years old, and importance of completion of the course. Reinforce screening, that encourage the woman that cervical screening is not eliminated if she is receiving vaccination, and she has to continue her cervical screening as per the guidelines. And if she has any concerns, any expectations, so any questions, then invite questions, create a space for her concerns and answer with empathy and evidence-based information. So I hope this task will help you for your exam preparation. And we at StudyMEDIC wish you all the very best for your upcoming exams. Have a great day.